A focus on fraud brought legislators back to the Minnesota Capitol for their very first official work since the budget passed. They dug into human services and especially Medicaid today. Fox 9's Corin Hoggard has tracked all of the developments. He joins us now live from the Capitol. And Corin, they have two vastly different approaches to protecting services and funding for the state.
Yeah, that's right, Simone. Republicans and Democrats had very different lines of questioning here as they approached this, but they were united in their tribute to Speaker Emerita Melissa Hortman right off the top.
That is still a process we are all dealing with and grieving.
The work that we do here is really about people and the impact on people, and I feel like she pushed us so often to be thinking in those terms.
1.3 million people in Minnesota get health care coverage through Medicaid from 300,000 providers, including doctors, hospitals, and nursing homes. It's a $20 billion annual program in the state with a 2.2% rate of improper payments. That's less than half the national average, but as Representative Marion Rarick pointed out, it's still more than $400 million.
It's important to know improper payments does not mean fraud, right? There's a lot of administrative error, a lot of, documentation issues.
The Department of Human Services is also bracing for federal budget cuts signed into law last week. They're expecting $500 million in lost funding and at least 150,000 people losing their health care.
We will have to deal with the impact of that as it relates to Minnesotans, working class Minnesotans, rural hospitals, and frankly, the taxpayer dollars at the local level that are going to go up.
Counties are projecting property tax increases when the impact hits in December 2026. But some Republicans embrace the pending cuts, pointing to similarly sized states, Colorado and Wisconsin, each of which spends about $13 billion on Medicaid.
How is it that Minnesota provides $7 billion more than those states?
We do have a more comprehensive set of benefits, either through waivers or more generally in the program in our state plan, both for seniors and people with disabilities.
DHS did identify some high-risk areas of optional Medicaid coverage here in Minnesota that included sober homes as well as autism centers, and they said that is where some sketchy providers are really committing the bulk of the fraud here, at least in DHS. The legislature put up some guardrails around those programs this year, but there are members of this committee who would prefer to add even more next year. Live at the Capitol, Corin Hoggard, Fox 9.
Thank you, Corin.